Welcome back, everybody. And so continues our videos on how your adjustments directly and positively impact your immune system. And today's study takes us all the way back to 1986. And I've shared this study with our team before. It's one that chiropractors hang their hats on a lot, and rightfully so. But it does have some downfalls. We'll talk about that at the end. But this study was done by Dr. Pero, and he was the chief of cancer prevention research at New York's Preventive Medicine Institute. All right, so kind of a big deal. He was also a professor of medicine at New York University. This study overall showed positive effect that chiropractic care has on the immune system and overall general health, right? So Dr. Pero was extremely interested in hormones and how it's affecting his cancer patients. And he then took a step back. He wasn't getting the results that he wanted to get during his initial trials and his phases in his research. So he said, well, what controls the hormonal system? What has a direct influence on it? And of course, he said the nerve system. And then he said, well, who are the only doctors, who are the only providers that claim that they can impact the nerve system? And that led him to chiropractic. So he teamed up with a group of chiropractors and measured the immune systems of people under care. And this one was under care for at least 5 years and compared to those just in the general population, right? As well as those that had cancer and other serious disease. So this was a 3-year study of over 100 individuals. And again, the chiropractic patients had been under care for at least 5 years, right? But during that time, the chiropractic patients were found to have a 200% greater immune competence than those who had no chiropractic care and those who had no cancer or serious health issue. Now, the chiropractic group compared to the people that had cancer or a serious health issue, it was actually a 400% greater immune competence than that group. So it's pretty incredible. Now, the superiority of those under chiropractic care did not appear to diminish with age, which is extremely important because who is the largest age group that's being affected by our current virus? Of course, the elderly. So I'm going to quote Dr. Pero when he said, when applied in a clinical framework, I have never seen a group other than this chiropractic group to experience a 200% increase over the normal patients. He goes on to say, this is why it is so dramatically important. We have never seen such a positive improvement in a group. Now, I told you I was going to list one downfall of the study, and here it is. This study also took dietary factors into account, and it failed to distinguish. The results here were phase 1 results, and it failed to distinguish the effects of the dietary practice. Now, this was supposed to come in a later phase of this study, but never did. But Dr. Pero continued to back up chiropractic adjustments and the role it had in your immune system. This is a gentleman, a medical doctor, who produced over 160 papers. Okay, so this is not a one-off. He then went on to say that he was not aware of any research showing that such differences in the immune system could be accounted for by nutritional changes alone. And he went on to wrap up to say he firmly believes that chiropractic care was the critical factor in this study. There's your nugget for today. There's continued evidence to support that ability is making the right decision to keep these doors open and serve our population and help our community in times of dire need.